First step in the TOV is to find and palpate the sinus tarsi. And we'll put the foot through a range of motion. And palpate, it's right there. Following relaxed skin tension lines, we'll make our incision directly over it in this orientation. First step, hold the foot. Make our incision through the skin, taking care to avoid the intermediate branch of the superficial perineal nerve and the sural nerve back here. Make our incision through our sub-Q and spreading the tissues down to the sinus tarsi. Once we get down to the sinus tarsi, retraction. The first step is we're going to take our probe, place it into the sinus tarsi, and the orientation kind of helps you to start distally, laterally, and work your way back across to the medial side of the foot, making some big swooping motions as you introduce into the sinus tarsi. Once the probe is inserted and you know you're in the sinus tarsi, we take our guide wire. Guide wire passes through the cannulation on the probe, and you can feel it tent on the opposite side of the foot. Once our guide wire is in place, we take our probe off. Starting with the smallest, which is an 8, and they're color-coded, the blue to the blue, we're going to start with our sizer, introduce it over the guide wire, and introduce it into the sinus tarsi, just to where it starts to become uniformly, and the diameter and the shaft is all uniform. Now, once I get that in place, the key to this is understanding how much correction we want. I'm going to grab, since it's a left foot, I'm going to grab the subtalar joint with my left hand. So I want to grab the calcaneus, and as I load the metatarsal joint, what I'm checking for is locking of the metatarsal joint to know I recreated an arch. So I feel for stability in the rear foot, and I feel for locking of the metatarsal joint. So in this case, I need to go up to a larger size because it's too small to hold the arch and get the correction I need. Making sure the guide wire stays in place. And we're going to go up to a 9. We're going to try the 9. Introduce it. Hold the calcaneus. Load the metatarsal joint. Now we're going to go up to a 10 because I want to feel that I have enough stability in the metatarsal joint and the calcaneus is not flopping in valgus to know that I created an arch and the TOV is going to hold the arch in place. Introduce it to where the diameter is uniform, right to where it starts in the sinus canalis. Load the foot. And this is a size 10. So in this case, we're going to go with a size 10 because it shows the correction that we need. If I needed to go any higher, there's an 11 and a 12, which will go, which you probably can't even see in here. So now that I have my TOV on the screwdriver, it's perfectly cannulated. Introduce it in, retraction. We always retract the skin. We don't want to drag any bacteria in there because implants have to be very careful. Keeping the skin out of the way, letting it introduce, staying on the guide wire, not forcing anything, letting the guide wire take us where we have to go. And as I load it in, check it with a C-arm. And I have plenty of pictures with C-arm showing these advanced in. Now I feel it starts to bite. Take it off. I check for my correction, making sure it's a nice stable foot. And that's it. Now, if I have to take this implant out, I have my guide wires in place. I take my screwdriver, go over the cannulation, and get myself seated into the implant. Now I'm seated in the implant, and in order to take it out, you have to have it grab, because if you try to turn it out, it doesn't come because the soft tissue doesn't hold the threads. So you take the guide wire out and introduce the extraction tool, which has reverse threads. And I reverse them into the implant over the cannulated screwdriver, applying direct pressure down on the foot. Once the reverse threads catch, the implant comes right out. There's the implant.
Show him that, yeah.